practitioner. And I'm still Carol Penfield. Okay, well, welcome everyone. I've been a nurse practitioner since the early 90s, back when no one knew what a nurse practitioner was. And for many years, helped folks in the office setting, health club setting, etc. But now I specialize in a, let me just get this going right. A specialty called lifestyle medicine. So just to give a quick example of this, of what that really means. So really my approach for my patients, my clients, is really looking at how to manage chronic conditions or prevent chronic conditions or ailments through preventative care. So a lot of times we go and we get the x-ray of our knee or the x-ray of our back, or we have our mammogram, or we get our pap smear or what have you, and kind of cross our fingers hoping they don't find anything. Now that's really primary care. It's about early detection and treatment. But lifestyle medicine is taking a step before that and looking at how to prevent these conditions or manage these conditions through how we live our life day to day. So they will hear quite a component today of nutrition, even in addition to exercise and other things that are going to affect your knees and your hips. So what you eat, how you move each day, how you manage your stress, how you sleep, usage of cigarettes or substances, having good social support, and managing depression if you have it. All of those play a big role in how you live a long, healthy life. So there'll be a little bit of that along the way as I speak to you. So I always like to start with kind of an overview about arthritis. A lot of times people get arthritis, osteoarthritis, and osteoporosis mixed up. So just want to make that quick and clear that osteoporosis is a thinning of the bone, where osteoarthritis is a wear and tear along the edges of the bone, where the bone articulates with another bone or a joint. So here we have two major types of, looks like we have someone else who wants to come in. Are you able to, Harriet?
Yep, right.
Patricia's coming on in. Okay. So we have two major types. One is your wear and tear osteoarthritis, which is really what I'm going to focus on mostly today because we all have it. And secondly is inflammatory arthritis. So that's more like your rheumatoid arthritis, your lupus, your psoriatic arthritis, those sorts of conditions. I worked in rheumatology for many, many years, helping people manage these conditions. However, inflammation does play a role in all types of joint conditions, which we'll talk about in a little bit as well. So just as an overview, this is kind of a generic joint. We'll go into specific hip and knee in just a moment. But here's your cartilage. Here's that smooth surface along the end of your bone. That's there to help protect. You then have your synovium here, which is the blue on both sides. And the joint capsule is the purple. So where your joint is, when you have two bones meeting, is your joint. You have this capsule around it, and that capsule, those cells are able to make fluid. So often, you might get a swollen knee or feel, fullness in your hip, or you bang an elbow and it swells up. Your body tries to make fluid to help heal, or it does it in response to wear and tear or inflammation. We also can develop bursas, which are these fluid-filled sacs, which is where soft tissue is moving over a bony structure. And you can make them anywhere in your body, and I'll show you specifically where they are in your knees and your hips. So those fluid-filled sacs are just to decrease friction, but they get inflamed and irritated as well. So the rest is bone and muscle, which I think is pretty clear. So let's take on the knee first. So if you're looking at this knee is your what does that say? Medial collateral, your lateral collateral. Okay, this is your right knee if you're looking at somebody. So if I'm looking at you like this, you're looking at my right knee right now. So let's kind of run through this. So you have your kneecap, which is your patella. And as you see, that's a bony island. That floats right over your general joint space of your knee. So maybe when you go downstairs, you kind of can hear clunking and crackling. You get up from a chair, you can hear kind of thunking and clunking and crackling. A lot of that is the patella, which is tracking along the kneecap, along the front of the knee. And you can get arthritis behind that. You can get wear and tear behind that but that's not the usual wear and tear that you get from weight bearing, which we'll talk in a little bit more about. We have somebody else that wants to come in, Harriet. Harriet?
Yeah.
Okay, you're all set? Okay, I just want to make sure you saw that. Okay, so we've got the kneecap here, you've got tendons and ligaments. So you have this patella tendon going down, and then you have the quadricep tendon going up. So as a reminder, what a tendon attaches a bone to a muscle, okay? Your ligaments attach bone to bone. So you have 4 major ligaments running on the outside, running on the inside, and 2 crisscrossing underneath that keep you from going crossways, sideways. And then you have your tendons here. So these are ligaments and these are the tendons. Okay, everybody clear on that? It kind of gets like, ooh, why do I really need to know all this? Well, you sort of have to get an idea when you're feeling what you're feeling in your body, what it might need. So that's what I'm kind of trying to help you understand here. You also have the meniscus, which is kind of like a donut, I like to call it, which is an extra padding in your knee. So you have the cartilage at the edge of the bone, you've got the meniscus padding, and then you've got the cartilage and the bone at the bottom. Have I lost anybody yet? Did you like to skip anatomy, physiology in high school? Let's see if there's anything else I wish to say here. So often with tendons, you can get tendinitis, inflammation. With ligaments, they tend to tear, and that gets to be kind of tricky because it's a very difficult thing to have to fix. You have to sew that back up. Okay, getting ahead of ourselves. So let's go to the hip. And once we're that, okay. So welcome people at home. I think we got a few now. So just an overview of the hip here. Let's start at the top. So this is the right hip, and I'm standing here looking at you. And you'll see here, we also have this funny little ligament there. So remember, ligament is bone to bone. And you've got lots of ligaments down here outside the joint capsule holding that hip in place. So back to the knee is a hinge joint. We don't really want it to go right and left and sideways. We just want it to bend and straighten. That would be nice if that was all it did, and that's what those ligaments are trying to do. With a hip, your hip has a ball and socket, so it's a much bigger circular motion. So lots of things can happen because you're kind of, it's a little bit more suspended, so to speak, with your weight-bearing pressure kind of holding you in place. So in here, you also have that fluid-filled sac again, where that area, the synovial cavity. So that's the lining there that produces fluid and then can produce also some thickening in there. And then we have the labrum. People may have heard of labral tears with people in hips and in the shoulders. And that's sort of this lining, this kind of a cartilage combination sort of lining there that can also tear or rupture and cause issues for people and discomfort. So it's not only just bone on bone, there's also soft tissue here playing a role. Okay, everybody all set? That got their anatomy lesson all done? All righty. So what causes arthritis? We sort of have an idea by just based on that first picture is obviously mechanical injury plays a big role. In irritating, you get sort of a jam or a twist or a tear, and all of a sudden the cartilage starts to get irritated and breaks down. Also asymmetries. A lot of times when I see people in the rheumatology office, they have wear and tear osteoarthritis of a hip. Usually there's one leg longer than the other, or they have scoliosis, or they've had a broken something or other. So they've been walking for years unevenly. I mean, I'm exaggerating right now, but it will cause some wear and tear. So asymmetries play a big role, and we get crooked quite easily with injuries over the years. Inherited, we can always get to blame our parents for something. So arthritis is another example. Let's see if I can let this person in. I don't know if I can, let this person in. Or come back, sorry about that. I got one more person. I think it's gonna fall off. Okay, we don't want it to get, yeah, we don't want it to get injured. And, it's got a magnet on it.
Oh,
So, okay, so inherited, so some people are more likely gonna have wear and tear arthritis of their knees or hips because their mother or their father had a replacement when they were, 40, 50, 60, younger ages. Weight plays a big role. So we'll talk a little bit later of that, but these are weight-bearing joints. So the more weight on those weight-bearing joints, the more it can wear and tear and irritate the structures. And then some people get micro fissures or little cuts and crevices in their cartilage, and that starts to make it wear down faster. So we have biochemical. This is a little more into the inflammatory side of things. I put this up here, this is like alphabet soup, but the reason I put it up here is because I'm going to show you later how actually what you eat affects these biomarkers, affects these inflammatory markers such as cytokines, inflammatory proteins, interleukin, IL-6. The point here is prostaglandins communicate pain, cytokines cause inflammation. So there's substances, we'll just call that, in your body that are doing that. Ready and willing to. Uric acid crystals, so gout or pseudo gout, which is calcium pyrophosphate deposition disease. Anyway, pseudo gout. So these are when folks have a buildup of uric acid crystals or calcium crystals that are deposited in the joints. Usually see that more in the smaller joints, but you still can see it in the knee typically. Okay, and then markers for adipose tissue, which is sort of interesting. I just say that the more fat cells we have, the more those fat cells are able to cause these inflammatory markers to raise havoc. Okay, so let's look at that inflammation side of things just a touch more. Again, alphabet soup over here, but what I just want to have you pay attention to is that it's not just the wear and tear of that articular surface, that cartilage, but also the body sending inflammatory synovial inflammation and different types of cells and proteins that break down that cartilage. So we can't regenerate our cartilage. That's kind of the bad news here. So when it wears and tears and breaks and comes apart and doesn't do what it's supposed to do, just have a nice smooth end to your bony structures, then things happen and discomfort happens, unfortunately. So I'm just going to pretty much leave that here. So the inflammation causes the tissue damage, synovial thickening, and osteophyte buildup. So when that happens, your body wants to try to help. So it's going to send inflammatory cells there, but also it's going to try to grow bone where it thinks it's going to help. So some people can get bony spurs, bony thickening, bony islands that can occur around the hips and the knees. This is all just the body trying to help out, but it kind of overshoots, which is sort of in simplistic terms. All right, everybody still with me? Okay, this is kind of a busy slide here, but a couple of things. And just sort of looking at the thing about hips and knees. When you have hip pain, when you have knee pain, if someone comes into the office, I always look at the joints above and below. So hip pain, you want to think, make sure it's not coming from the back. Knee pain, make sure it's not coming from the hip. Knee pain, make sure it's not coming from the ankles or referring down from the back again. So you have to keep an open mind, and it's really important to have a good assessment of when you're having that discomfort, where is it really coming from? So osteoarthritis, hip arthritis is less common than knee arthritis. And it's also more common in women. So what happens with us women is we tend to have a wider pelvis because we bear children, lucky us. And the leg bones come on in, the femurs come on in this direction, and then your kneecap is tracking this way. So we're a higher risk for mechanical issues of our knees. So women tend to have more knee osteoarthritis than men. And your weight plays a bigger role on your knee arthritis and less so on your hips. And then as we look down, the other thing is you sort of, when you're trying to assess what's going on, a lot of times with the hips, people say, gee, I just can't put my shoes and socks on anymore. Just can't get that leg up. So it's usually that rotation of the hip is pretty classic. And also with sexual intercourse, being able to rotate hips out tends to be an issue too that folks have noticed with that. With knees, it talks here about buckling or giving way. So you're walking along or you're going down the stairs or something and the leg gives way on you. That often is the quadriceps talking to you and saying, wait, whoa, something doesn't feel right in the knee, and the muscle shuts down and gives way. That's pretty classic for arthritis of the knees. But of course, exercise will help. We'll talk about that a little bit more. I want to touch upon soft tissue, because a lot of times when people have hip and knee issues, they think they're a goner, they think they need a hip replacement or a knee replacement. There's a lot of other things in between that may good for you to try to sort out on your own sometimes. So I'm going to talk about bursitis of the knee. So I mentioned earlier, that's a fluid-filled sac that occurs that you can create somewhere where there's friction. And the typical places on your knee are right under that kneecap or on top of your kneecap, just above the quadricep where the kneecap just below, and then just on the inside here. So fairly classic, you know, you can touch and you can feel where your kneecap is and go inward to the inner side and then down a little bit. And often there'll be a kind of little tender spot there called the ansa inversa. So that's not to be mistaken for osteoarthritis, that's a bursitis, and often it's a change of shoes, walking uneven, that friction changes, really responds beautifully to ice and also beautifully to a local steroid injection. All right, then we have ways that you can manage your kneecap tracking, making sure that it stays in its right path, is these kind of knee braces that have the patella cut out. And a lot of times that just helps when people are getting that clunking, crackling kneecap alignment issues. This works well for those folks. And for those people who have literally bursitis or tendonitis above or below the kneecap, this more open structure works well. The reason why something like that works well is you put it firmly here so that the tugging is not occurring down in the vulnerable area, that the muscle up high is doing the work more. I don't know if that makes sense to you. But if you put it, you know, enough pressure here as you move, then the muscle's doing the work, and this part of things, the area just below where the pressure is left to heal. So that works nicely too for prepatellar tendonitis. All right, so now let's look at the hip.
Question.
Yes.
Could you go back to that?
Sure.
Okay, if you have pain, you said another type of pain is it's on the inner aspect of the knee, a little bit further down.
Correct.
Would you wear any of those type of braces for that?
Not so much. No, this would be really more for either kneecap, just above the kneecap, or below.
Okay.
When it's in the inside, the one thing the one thing about the pain on the inner part of your knee is if it's at the joint space, you're moving your knee and it hurts right at the joint space, and that might be meniscal irritation. If it's truly below the joint, so my knee is bent, my finger's lower than where I'm bent, that's your answer in bursitis, and that responds to ice. But these sorts of structures don't necessarily help.
Okay.
Structure is not the right word. The devices or items don't help so much. Yeah.
Okay, thank you.
All right, everybody all set with that? Everybody's knees hurt now? Okay, let's take on the hip. So as we mentioned, it's a ball or socket joint here, but there are areas that you can get bursitis here. The most most typical thing, I used to make so many friends by injecting the trochanteric bursitis, the trochanteric bursa right here. So you have your hip has this little out pouch coming out here, and just on that tends to be a fluid-filled sac there, a bursa. So if you're having pain on the outside of your hips, that is most likely going to be bursitis, because true hip arthritis tends to be hip and groin or deep buttock if you've ruled out your back. Okay, so if you're out here going, ooh, I lay on that side and it hurts, that more likely than not is going to be your trochanteric bursitis. Responds beautifully to ice, responds beautifully to local steroid injection. As I said, I made a lot of friends injecting that area. It's not like you're injecting a joint. That's a different situation. You can inject soft tissue more frequently, shall we say. You also can develop a bursa into the actual groin space. So sometimes when you think you have tendinopathy of the hip flexor, it could be bursitis. And the other more typical one is on the ischial tuberosity, or on your sits bones, where you sit down in a chair and you go, oh gosh, I can't sit here, this is terrible. Well, that's right here on these little bony structures here, you can develop a bursitis there as well. And that's where those foam donuts play a great role, where you have a big cutout in the center so that the pressure isn't on those sits bones anymore. You can put the pressure somewhere else around that rim, so to speak. Because when you think about it, if you sit on a toilet seat, there's no pressure in that area. So it's that kind of concept. You get a foam donut that's in the same shape as a toilet seat that will help, disperse the pressure there. Okay, so.
So does that respond to ice as well?
Yes, it does respond to ice.
So
The problem with it is that it's very hard not to sit. So it's easy to irritate it a lot, and that it's hard to get them better, but all bursitis do get better over time. It's just, it takes a lot longer than we want it to. So ice does, it definitely does respond to ice there too. And speaking of ice, this is sort of one for the trochanteric bursa area, which you can strap on and wear on the outside of your hip. This is a lady, touching the outer part of her thigh. That blue is all ice pack, and you can strap it across. So the key to here, in reference to ice, gonna get a little ahead of myself, but for treatment of bursitis, first is to rest that affected area as best as you can, which can be difficult to do because we still have to walk and get around. But ice plays a huge role. So ice is back to that inflammatory response that happens, and that's what ice does. It snuffs down that response so the body doesn't overshoot with redness and swelling and pain. The key with ice is that longer isn't necessarily better. Frequent is better. So 10, 15 minutes, 4 times a day is better than a half an hour once a day. So that you're kind of staying after it, or icing it after your activity that bothers it. You've been sitting for a long time in a movie, and I'm gonna want to ice your ischial tuberosities, or you've been walking for a long time, you want to ice up that trochanteric bursa. 10 or 15 minutes is enough time to snuff down that response, and then see if you can return to it frequently. Okay, so peppermint oils, have you had any luck with peppermint oils? Have you ever had any?
I haven't tried it
Patients, or I haven't either. I came across this and I said, I don't think I've ever used that, or frankincense oils to help improve circulation. But I think, you don't want to over rub an inflamed bursitis because it will inflame more. So you have to be sort of hands off in those areas when the time comes. But stretching, which we're going to talk about in a little bit, and trying to maintain your body positioning as best you can. So I can't say enough about your footwear. I can't say enough about your footwear. It's your only shock absorption that you have any control over. We replace our tires when they wear out. We need to replace our shoes. And that's every year. That we really start, even if they look okay or what have you, the insoles, your footwear needs to really be switched out, because that really helps a lot, taking wear and tear off of your knees and off of your hips. Soft, good, cushy socks make even a difference. So that's helping with relapse. And then lastly is healthy diet and exercise, which we're going to touch upon next. Any questions yet?
Yes.
Yes.
You mentioned footwear. If you have adequate footwear, is it worth going to a place like Good Feet store, or is that just bogus?
You know, I think that, I sort of switched what I've asked people to do. I actually refer people more to running shoes.
Okay.
Believe it or not, because they take a heel strike better than other shoes do. I used to have people get walking shoes for walking shoes, but now I'm really sending people out for, having shoes or sneakers that, just have a lot of shock absorption, have a lot of support. To get into the orthotics and all of that, I think under appropriate evaluation by, a chiropractor or a physical therapist or somebody that can really look at your whole kinetic chain and say, okay, he has falling arches, that's setting his knees up. Or she's got high arches, that's setting her knees up. So is there a way to get those feet aligned up better so that the knees are lined up and the hips are lined up? I don't think you have to go spending outrageous amounts of money on it. But I do feel that it's important to keep, fairly new shoes on your feet to just help with shock absorption.
How about Skechers?
I think they're okay. I think they're all right. I tend to, recommend New Balance. I have a very, very wide feet, so I tend to, move, folks with wide feet use Sauconys. Nikes are okay, but I tend to really like New Balance better. Rockports, they're expensive, but those are a good walking shoe. Yeah. Okay, so when we're looking at our treatment for our knees and our hips, I want to think about it for a few things. So the first is you want to be able to maintain range of motion to that joint. So as I mentioned before, our knees do one thing. They just hinge. That's all they do is hinge forward and back. A leg, you've got your hip, you got the full circular motion all the way around. We tend to be able to lift front a lot better than we lift back. As you see, we get tight here and the low back doesn't like going back there quite as much. So range of motion is important. Next is flexibility. So let's all see how we are on that one. So you're gonna grab a shin and bring that knee in towards you and try to bring that shin as close as you can, that heel to your hip as close as you can. Nice and flexible. Yeah, and now let's see what the other side feels like. So can you get that heel as close as you can to that hip? So keeping your hands a little lower so that you're bringing that ankle in. That gives you a good idea of that flexibility. Okay, and then straightening it. So are you able to rest your heel on that floor? Is that knee as straight as it possibly can? Come up on the edge of your chair. Just get that knee nice and straight. And then just put a little pressure on your thigh. And say, okay, does that get all the way straight? It's looking pretty good around here. Straightening it all the way. All right, so bringing that leg in, other leg, so resting on that heel, knee is straight, little pressure onto that thigh and see if that stretches out okay. So when you think about our legs, if we're walking and our legs are slightly bent, we're now already compromised into this position. You want to be able to have a nice extension of that leg as you heel toe walk, and that leg swings through. So hip flexibility a little harder. So let's try. Let's all turn to our right. All right, and now that front, left.
You're not quite within view of the camera for folks at home.
All right.
Ask you that.
Sure.
There we go.
Okay. Am I now?
Little. I'm still not seeing you yet.
Okay, back more?
I can't make it out.
Did you rotate the camera?
Or this way?
Sorry for the interruption.
I'm sorry.
Maybe it's this way.
Okay, there it is.
Maybe it's this way.
Yes, that is correct. Good. Thank you.
Do you see me?
Yeah, move over a little bit.
Even more?
There you go, I can see your head, yeah, perfect.
Okay,
Great. Thank you very much.
all righty. No, it's fine. I get going. I don't know where, you know. Okay, so this is gonna be your left leg. So your left leg's gonna come off the back side and the knee's gonna be pointing down to the floor first. So can we do that? So it's gonna be that leg going back, your left leg back. Everybody's left leg. Okay, so does that knee go straight down? Okay, that's phase one. Now walk, scoot that leg back. Can you get it to go further back like you're gonna do a split? You can help it back there too. So it's about how far back can we get that leg? That's stretching our hip flexor here. So that's evaluating our leg swing back behind us. All right, let's bring that leg in. Come around to center. And now we're all gonna go to the left side. And so that leg now dangles down, so the knee points down towards the floor. And scoot that leg back, so the person that kicked you in the last one, you get to kick it back. So as that knee goes straight down, now I recognize you. Okay.
That's great.
Okay, and you use the square dance? Yeah, all right, bring that leg back a little further. Best as you can. Does everybody feel a little stretch in the front of that hip? I can't tell you how important this stretch is right here. I can't tell you how important this is for hips. We're sitting all day long, we're driving, we're, you know, bringing our legs up in front of us. We're trying to spend some time stretching back that opposite way. All right, bring that back in. Yeah, not always a lot of fun, but what you can do to make that a little easier is you take a plate, like a paper plate, or it just be in your socks, and you can slide that leg back until you find wherever that stretch is. You'll see that picture as we go on, but I just wanted to kind of throw that in there to keep you guessing a little bit. So flexibility, so how far back can that hip go? How far forward can that hip go? How far to the side can I get it to go? Can I get it to cross center line? So that's all range of motion, flexibility. Then the third, once you've gotten working on those, the third is stabilization. Can my knee hold me in this place? Can my hip hold me? Can it still hold me when I'm coming down and coming back up? Oh, hi people at home. Often you'll find if you have a knee or hip issue, you default over to the other side. And you say, oh gosh, I'm waiting in the grocery store and here I am on my left leg. Those are great times to just say, you know what? I'm waiting to check out. Let me get on to that affected side. Let me just spend some time standing on that leg and just working on the stabilization. Okay? And then lastly, once those are feeling okay, the fourth, which is the approach of physical therapy, is to work through these four components. The last is to add in strength, which we'll do later. I'll make you think about that one for a minute. All righty. So your best things for your hips and your knees are non-weight bearing activities if you're having difficulty, say, walking. So picking things like bicycling or swimming or even rowing, those are all things that you're sitting or your legs are out somewhere or you're buoyant in water. So it takes away all of the weight bearing symptoms that you're getting. So whenever you can do those, that's great because you want to really, really increase your circulation to those joints. Because we've learned now that the whole key to arthritis is to improve circulation all the time. We feel our crappiest when we first wake up in the morning. We get up, we feel 105 years old and the hips and knees are talking to us because we haven't been moving, because there hasn't been circulation to the areas. So finding a way to move as much as you can comfortably. Even those sitting pedalers, you know, those little pedaler things and you go like this right in place. Why not? My mom's got one. I hope she uses it. Okay, so flexibility, of course, that will help decrease your stiffness. So doing the stretches that we've just reviewed some of those, then moving towards muscle strengthening and to support the joint if you need to have ways to support the joint, which I showed you. And weight loss plays a big role. This is an interesting little statistic here on weight. So for every pound you lose is 4 pounds less stress on your knees and 9 pounds less stress on your back if you're leaning forward and 11 pounds less stress on your ankles. So when I work a lot in the rheumatology office, helping people losing weight before they have their knee replacement or losing weight to hopefully prevent knee replacement, these are great statistics. You lose 5 pounds, that's 20 pounds less stress on your joints right there. And 5 pounds kind of feels okay, approachable for some folks. You know, if I said, okay, I'm gonna give you a knapsack with a gallon of milk, and I'm gonna make you wear that on your back, and you're gonna go walk around the mall, you're like, oh, you come home, your knees and your hips will be achy and sore, because that's 8 extra pounds on your back. So it plays a big role. So it's exponentially in our favor. So each pound is 4 pounds less strain. Okay, so here we go with some exercises. We've done a fair amount of them already. So we chose the stretching movement here in the chair with a leg out in front of us. That's easy enough to do while you're watching TV or whatever else you are doing. You could also say, well, you know, this bugs my back, leaning forward, and oh, I feel tight everywhere else. You can do that in a different way. You can be lying flat, keep the back out of it, and then the leg comes towards you, such as with that elastic band. Okay? That helps stretch out your hamstrings because you want to make sure that you don't start to get contractures in your knees, which cause you to then not be able to straighten them. We just did the knee to chest already. The nice thing about doing it lying down here, she's got that leg out straight. So there we are again, trying to stretch out the front of the hip as you're bringing the other knee into the chest. So that's also feels good. And we just did that one. Again, that's if you don't remember anything else today, I want you all to go home and do that exercise. I can't tell you how many people's backs feel better, and certainly will help hips as well. Because again, you know, is it the hip that's causing the problem or is it the back causing the problem? So that's a hip flexor stretch. This is another way of doing it. This way you can do it lying on the bed and you just passively let that leg just dangle down. I really like that one because it's, you know, we were all kind of fidgeting and trying to get into position when we were doing this one right here. But this one allows you to be able to let that leg dangle and you just relax there for a while. Let that arm go down too and you can stretch your chest and shoulder. Another way is to do it off the front end of the bed. I sort of like the side better myself. This is also another way to stretch out your hip flexors and a great way to work your glutes, which are the muscles that support your hips from the back here, your buttock muscles. If you're to do that one, you can do it one way is just lift it up and hold it and maybe take your hands and hold your hips as high as you can and hold it for 15 seconds. The other, as a strengthening exercise, would be to lift, squeeze the glutes, come back down, lift, squeeze, come back down, 10, 15 of those, a couple times a day, or as often as you want. So this is the internal or the external rotation of your hips, which we can, you know, you can actually just do that a little bit right here, where if you place your feet together, if you can see me, feet together, and you can press open on your inner thighs, bringing those heels together. You can kind of, you know, open up those hips a little bit into this direction. You can also do it lying on the bed, lying back into what I call frog leg position. Great way to sort of stretch that area out. Another is to take, I don't have a picture of this one, so we'll do it all together here. Is everybody able to get their ankle on their thigh? If not, you can start with the shin and slide it up to wherever it's willing. Okay, so we all picked one leg, and all have different legs up, but that's okay, it doesn't really matter. So here we are, sitting nice and tall. You can add a little pressure against that leg to kind of help that hip open up. And now if you want to add more excitement to it, a little lean forward. So that's your hip rotator, it's your piriformis, that's the muscle that runs across your buttock. You probably feel that kind of running back here. Okay, that one can get cramped down and tight And the back can get blamed for this, for having sciatic radiculopathy or back pain coming down. And that's this hip rotating muscle can be tight with piriformis. Let's try the other leg. So again, you can start low if you have a hard time, just slide the leg up and just let the hand hold it to wherever you can. If you can get there, great. All right, so now that ankle's up there. So first was to sit tall. Always want to be in good posture. Then, is that the elected side? I don't think so. No, I missed it. I just missed it. How was it? All right. And a little pressure on that thigh. So we call it the affected side. We don't call it the bad side. So we're not in grade school anymore. The affected side. All right, a little lean forward if you got it in you. All right, so you feel that. That's your hip rotator piriformis. Okay. Now, there's also another one called the obturator, which is when you bring the knee across and kind of twist into that one. Oh boy. So the knee stays up. So bring the knee up towards the chest, across to the opposite shoulder, and maybe even lean into it a little bit. This is often one a little harder to find. Everybody okay with that? And we don't want the other side to be neglected. So let's bring that leg down. So across the leg, bring the knee towards the chest, across to the opposite shoulder, and a little lean into that side. So this is a different hip rotator muscle. Everybody feel like a pretzel? Good, all right, bring that down. So for strength, because that was all flexibility, remember we want to start with flexibility, range of motion, and stabilization. Then when we get to strength. So for knees, this is as good as it gets for knee strengthening. Now, the one thing about the knee is if I'm going upstairs and I rock forward, your knee will feel that quite a bit. Same as if I'm going downstairs. Oh, right? This leg doesn't like doing it too much. See how that knee is rocking over that toe? So whenever you're strengthening, you want to keep the knee lined up with the ankle. So I'm going to use a step up. I'm going to step straight up, but not forward. All right, so it's just up and back down. Okay, and you can start with something low. I don't think they have phone books anymore, but I used to have people use phone books. If you can get to a regular step, that's great. I recommend using the bottom step so there's nowhere to go. And you can start by holding the banister, doing that, or you can just do it on your own. And 10 to 15 of those step ups each leg. That will be great for strengthening the knee. It strengthens the hip as well. But also, the nice thing about this wall slide move is see that 90-degree angle again. So we don't want those knees rocking over the toes. You want to see those toes when you're exercising. So if I'm going to go against a wall, sorry people at home, you may not be able to see me, but if I go against a wall and my knees are out like this, but against the wall, I can get my feet out here. Now my 90-degree angle, my knees are nice and safe here. Practice going up and down, or you just practice staying here until they say, please don't do this anymore. Let those quads burn. So strengthens the quads and then coming back up. So I love the wall slide and the step up. Those are the most basic leg exercises. Anybody doing those? You get to go home and do them now. Yes, we all want to be able to get out of a chair. That's the 90-degree angle man. We all want to be able to step up a couple of stairs to get into our house or go downstairs. That's the woman in the red shirt. So they're very functional exercises. That's what we want our bodies to be able to do. That's what we want to practice. If it becomes easy, you can add some weight in your hand. You can hold that gallon of milk again. You can take a 5-pound hand weight with you, what have you. You will feel it a little bit in the kneecap tracking area, but the key is to not let those knees rock forward. All righty. And of course, physical therapy. If you have the luxury of having some physical therapy, it's always good. Always say yes. because they're great resources to helping, you with body alignment and teaching you proper body positioning and so forth. Okay, then the hip. So the hip is not just a forward and back situation, although we've already worked on that a little bit. I mean, you can do leg swings. You can do them out to the side. You can do a soccer kick across. Here, this person is lying on her side. Let's just take A and B first, the lady with the pillows. So she's lying on her side, the pillows between the knees, and she's lifting the leg up to the side and coming back down. And then on B, she's squeezing against the pillows, squeezing down against the pillows. So you got the lift up and you've got the squeeze down. So it's working inner and outer thighs, which is truly quadricep, but that's the location. The women in the far end, so she's now here, little softness to her knee, and she's sliding the foot out to the side. So you could take a plate or a disc or something and just slide it. Just sliding it that way. You can also slide it back and work that direction. Also, what's happening here, I'm working my balance. So with that disc move, this leg is doing stabilization, this leg is doing strength. And then you'll find one side is usually better than the other. Okay, all right, so there's exercise. I'm gonna spend a couple minutes ruining your diet plan. Are you ready for this? Hang in there. This is science that might be a little tricky for you. However,
Question,
yes,
sorry.
no, that's
The
good.
previous exercises.
Yeah.
Are they usually done to prevent problems, or are they usually done when you have problems and you say, I need to do something to help reduce the pain from the problems I'm having?
Right. Both, I would say, both in the right way. I mean, when you're inflamed, depending on what the inflammation is from, sometimes rest is important.
Yep.
So if you're really active, then that may not be the time. That's the ice, that's the rest, and so forth.
Okay.
It does both. It will, exercise has also been shown to help people with knee arthritis feel better than someone taking naproxen for their knee arthritis. They've gone head to head with anti-inflammatories and exercise, and they found that exercise can help with pain management as well as first line treatment, which is your NSAIDs, your anti-inflammatory medicine. So it plays a role both, really, for circulation, range of motion, keeping strength, keeping your function. Because if we spend 2 weeks in a bed, you know, we lose about 25% of our strength, 20% of our strength already occurring. We're not careful. So as we all learn now, everybody gets out of that hospital as fast as possible. You're on your way home. If you can walk, you're going home. So there's something to be said for that. We do need to keep moving as best we can. Yeah. Okay, so we have these things called advanced glycation end products called AGEs. It's a toxin that appears when food is heated, grilled, fried, and pasteurized. Oh, it sounds horrible, doesn't it? Well, it's a protein. It's a damaging protein, which your body tries to break down, and then it will create these cytokines. Remember the alphabet soup a few slides ago? The cytokines are inflammatory markers. They were going to cause inflammation in your joints. There you are. Okay. Now we also have omega-3s and omega-6 fatty acids. We've heard about those probably in the past. Your omega-3s we've shown are have anti-inflammatory qualities. Come on in. Hi. And omega-6s tend to do the opposite, tend to trigger an inflammatory chemicals and can cause increase in blood pressure and increase in clotting. So where do we find those types of foods? Your omega-6 fatty acids tend to be in your snacks and baked goods. So your crackers and things that are able to be on a shelf for a long time until you buy them at the grocery store. A lot of them will have these omega-6s. It's more about the balance of the 3s and the 6s. You get too much 6 and not enough 3. You want to have a lot of 3 and less 6, and that's what will help balance out the inflammation response. Then we have animal products. So we break down our animal proteins into something called arachidonic acid, which you'll find in meat, chicken, pork, egg yolks, etc. These will produce prostaglandins. Again, back to the alphabet soup, prostaglandins are proteins that cause pain in your body. And prostaglandins are, well, they're actually more of a lipid, they aren't actually as much of a protein. And they also will lead towards your inflammation, constricted blood flow, clotting, and pain. So, oh boy, doesn't this sound fun? Isn't this great? Then we got our sugary processed foods. If you haven't already felt horrible already, here we go. So sugar causes the body to release, again, cytokines, which are the inflammatory markers. White flour, white sugar. What happens when you take those in is you get a big, quick surge of a high blood glucose. The body says, wait a minute, we gotta get this glucose taken care of and put in the cells. We're gonna go make more insulin. Then the body says, oh, wait a minute, you're making all this insulin. Something must be wrong. I'm gonna inflame. So that's where your sugary foods, your processed foods lead to that inflammatory cascade. But on the other side, if we can get our carbohydrates to have more fiber in them, food in their natural form, fruits, vegetables, nuts, seeds, whole grains, legumes, that high fiber will talk to that healthy bacteria in your gut, feed the healthy bacteria in your gut and say, all right, you're good here, we don't need to inflame. So you're coming at it from two directions. If you're eating processed foods, you're not getting the fiber, and you're getting all that sugar, which is gonna cause that inflammatory response. So instead of saying what I can't eat, let's go right to what we can eat. So you wanna look at foods with anti-inflammatory qualities. So I think you may have read in the news, turmeric is a really nice, and curcumin are really nice spices, and ginger to help. Just sprinkling a little bit, all you need is a quarter teaspoon here and there. Doesn't have to be pill form, you don't have to overdo it. Just sprinkling a little in your food, a little on your salad, a little in your stir fry, and it will help with inflammation in your body. Sesame seeds, flax seeds, especially ground flax seed, you can buy it ground, it's gonna be digested a lot easier. Tablespoon in your cereal in the morning, you're good to go, that's all you need. Soy, also don't be afraid of soy, it's not associated with increased breast cancers or female cancers, that has been debunked. So soy is great for you. Pomegranates, pineapple, lentils and beans, there's that fiber again, bringing up the fiber, so you don't have the inflammatory response. Green tea, oh good, I'm not gonna mess with your coffee. You can have your coffee. Tomatoes, mushrooms also have anti-inflammatory components, olive oil, green leafy vegetables, all the usuals, all the good stuff, nuts and seeds, especially walnuts. And your fatty fishes, the smaller the fish, the healthier it is for you. So your mackerel and your sardines are better choices than your swordfishes or your large tuna. So smaller fish, if you're gonna eat fish. And your berries, so half a cup of blueberries on your cereal in the morning, you're good to go. It makes a huge difference. And then if you can get all that in the morning, then you can have fun with the next 2 meals. So you say, oh gosh, how do we know all this? It's very, very difficult to prove this. And this is why the food industry keeps this information from us, because they want to sell you as much as they can, the foods that are now on the shelves. So we can't just say, okay, I'm going to give you Cocoa Puffs and I'm going to give you whole, wheat cereal, and we're going to see who does better. We can't control for everything in people's lifestyles. She might be a smoker and she might be an exerciser. She may have terrible stress, but she eats, greens every day. So to be able to compare all of this and really get that data back to you, it's going to take a long time, and I'm not going to wait for that. Because we waited 50 years for smoking, the data from smoking being bad for us and causing cancer. So if there's anything here that looks like it's something you can do, pick it. Maybe it's just one of these things that you can just kind of throw into your repertoire, and hopefully it'll help your knees and your hips feel better.
What about pizza? See it on there.
Well, first you could start with cauliflower pizza.
That's true.
They do make pizza and the crust is made out of cauliflower, so that's a good start. You can get one without cheese on it, lots of roasted vegetables. And you can, have,
Why is cheese bad
why is cheese bad?
when it tastes so good?
Why is cheese good?
It tastes good.
Okay, it tastes good, we all know that, and, we all love it. So cheese is a source of fat. Cheese has no fiber in it. It has a lot of saturated fat and all those sorts of things. And it's not really a very good source of even protein because the fat in that cheese doesn't allow us to absorb the protein, which is only 3 or 4 grams anyways. And we found that it's not a good source of calcium. We thought for a while, well, let's have it for calcium. Again, the fat in the cheese does not allow you to absorb the calcium that's in the cheese. So you're not getting anything from it other than clogging your arteries and expanding our waistlines because it's very calorie dense. So I wish I had something good to say about cheese.
Are all cheeses
All cheeses,
created equal?
all cheeses are created equal.
Feta,
Pardon?
feta cheese?
Cottage cheese? All cheeses are come from cows.
Now I regret.
There are cheeses that come from almonds, there are cheeses that come from soy. There are vegan cheeses, but they're still fat. It's still a source of fat that
So don't
tastes really good.
eat cheese, is that what you
That's
said?
the story, that's
Do
the,
you never?
I don't eat
What
cheese.
about cream cheese on your beef? Bagel, but-
I don't eat bagel either, but it's not about what I eat or don't eat, but what you're putting in your body, what is it, it's your opportunity to fuel your body with something good for you. So you don't wanna miss that opportunity. What can I have instead of cream cheese on my bagel? I'd say peanut butter or almond butter would be a better choice. Still fat, however, it's a plant-based, it's nuts.
It
It's
doesn't
got
go with
omega,
lettuce.
it doesn't taste as good with lox, of course. Well, that lox is gonna go on your salad. That's gonna go on your nice green leafy salad. You're gonna put your lox on with that and your onions, because onions are great for you as well.
I also enjoy hummus and guacamole.
Hummus and guacamole on toast or bagel or bread or what have you as well. So cottage cheese, I'm afraid, is also dairy. Also very high in salt, which people don't even
Except cottage cheese.
That's the only thing. Yeah, you like it, yeah, it's okay, I have candy, and I want it. Well, but if you see if you can find something you like as well, because you also look at what it represents, it's something creamy, it's something filling. I say, okay, what can I come up with that's creamy and filling, like hummus is an
Ice cream.
example. Ice cream. Of course, and when you have that ice cream or you have that dessert or that sugar, your body needs more water to break that down, and now you're holding on to fluid as well. And we get a little puffy when we eat sweets, and now that puffiness gets around our joints, and now our joints hurt more. Let's see, hot fudge sundae, no knee pain, hot fudge sundae, no knee pain.
Go for the Sunday, go for the Sunday.
Yogurt's dairy. Yogurt is dairy. Yogurt comes in soy and yogurt comes in almond milk. That's ideal. Because the component of the dairy, if we went back to the breakdown of the proteins in that dairy, is what cause those inflammatory markers. And that's where people get kind of like, it may not be the thing you want to give up, and that's all right, but trying to make it less of your focus. But we're the only mammals out there that keep eating somebody else's milk. And why are we? Look, it's what we grew up with. It's what we knew. But we know new things now that lead us away from that more so. So if you can find an oat or a soy, a yogurt that you like, then you just, made that step towards, staying away from, the breakdown products of the dairy. And the also thing with dairy is it stimulates growth factor, insulin growth factor, and that leads towards growth of cells in our body. And we don't want to encourage the quiet, non-active bad cells in our body, like our precancer cells in our body. They've shown a correlation between dairy and leading us more towards that. But I'm getting ahead of myself. I don't want to overwhelm anybody at home or here. Yes, sir.
Just a quick comment on that. So we're going to be doing some health-related series over the next 3 months, which is something I need to talk to Carol about. To anticipate in actually October, which starts next week, right? So October is Breast Cancer Awareness Month. And so we're gonna be having a series of videos and discussing breast cancer and cancer. And some of the videos, and not all of the videos, will discuss just what Carol was talking about, and something like growth factor 1, which
Right.
is a major factor in encouraging those cells to grow.
And the other is you're doing osteoporosis next week.
On Monday, yes, we are doing.
So that leads us back to the dairy for women here who thought, gee, if I take dairy in, this is gonna be a great calcium source and my bones will stay strong. Well, now we know differently. So we'll talk about that more too, because we look at why we're eating what we're eating. So it's back to, is this the best source of calcium for me? Is this the best source of protein for me? Is this the best source of whatever it is you're eating that food for? And take a look at that and say, is there something I can eat more healthily? Yes, yeah, I think that's right. I think that's it. Yeah,
Good question.
yes.
On fruits. Fruits have natural sugars in them, so how do you relate those sugars versus refined sugars and so forth?
The sugars that are in fruit are carried with fiber. So there's a lot of fiber in your fruit. So when you're breaking down and digesting the sugars, the fructose from your fruit, the fiber slows down the breakdown, the digestion process, so that you aren't slamming your body with glucose all at once. So the fiber plays a role, and unless you're a brittle diabetic, don't worry about your sugar in your fruit. Unless it's a blueberry pie or it's traveling with other things, but it's the fiber that helps you digest and absorb it better. Did you have a question?
Talk about nutritional yeast. I know a lot of people are trying to get off cheese. They were suggesting,
Right.
It was all the rage for a while. It's good.
Yeah, it is.
It does kind of give you that mouthfeel.
A little bit, it does a little bit. She's talking about nutritional yeast, and it's something that you can buy in a shaker form, and it has other beneficial qualities to it, like your omegas-3s and other things. It has a little bit of a cheesy-ish taste to it.
What is it? Is it really?
It's yeast, yeah, yeah.
Like yeast you would make bread with? or-
Not the same type. I think it's,
Okay.
I know, I would have to look it up. I think it's deactivated.
Okay, like what you get like on the sourdough? Like
But it's
that?
deactivated.
Yeah,
I don't think
it
he does.
is, but it's still,
Okay.
it still has the fermented component to it though, because it is considered a fermented
Oh, is
food.
it fermented?
Yeah.
Oh, okay.
Yeah.
Probably why it tastes good.
It's good for
It
you.
does. Yeah,
It's good because it allows you to get the
Put
healthier bacteria feeding your gut.
it on your pasta,
Yeah.
Carol, I want to share a question from our Zoom audience.
Sure.
When someone is wondering whether living in a drier climate like the Southwest Arizona help with erosive osteoarthritis.
That's a good question. Okay. Osteoarthritis. Oh, I'm going to quote the rheumatologist I worked with for that 6 years. She said, the rheumatologists in Arizona are just as busy as the rheumatologists in Cape Cod. So the drier climate is an interesting comment. What I think the focus of how joints feel differently in those climate situations is really the low pressure and the high pressure, the barometric pressures. So are there as much weather systems coming through Arizona and other places? I don't have an answer to that. I'm not a meteorologist, but it's really the low pressure switching to the high pressures people can feel in their joints. Now, as far as erosive or inflammatory osteoarthritis, I don't know if there's a correlation of making it more wear and tear. I've never heard of that, so I don't think there's a relationship there. But if you're in a warm climate and you move more, guess what? Your joints are gonna feel better. And also moving more and staying active is going to nourish that cartilage as best as we can. Because there's not a lot we can do to get anything there yet. You're born with what you've got, and that's kind of what we're working with now still. So hope that answers them at home. So if you have any other questions, feel free, you can ask, but or you can go on home and work on your exercises. Yes.
Oh, me?
Yes, go ahead.
You had a slide where it said, if you lost 1 pound, it would be like.
4 pounds less strain on your knees.
So is the opposite the same? If you gained a pound, it would be 8?
Yeah.
4
Yeah.
pounds more on, okay.
Yeah,
Okay.
yeah. So it plays a role, a couple pounds here, a couple pounds there plays a role in how your knees and your hips feel, more your knees than your hips. But still, it all. Yeah,
Is this
Okay.
information available?
this information is available, and anybody at any time can either email me. I don't know if my emails, I think it's at the very beginning, can email me, but also I think it'll be in,
Right, folks who signed up, if you email, then we'll have your email on file if you.
yeah, you're welcome to all of this. Let me see if I have my email, and also, if you
They
also,
can't be sent out.
also, if you don't feel comfortable asking a question in a class setting, just email me. I will definitely get back to you. I'm happy to answer your questions as best as I can. Carol M. Penfield at Gmail, and I can also send this to you, or they can from here. Yeah. Yeah, thanks for coming.
Any other questions?
We're better already.
Carol, so this is great. I'm so pleased to see because you're here, Carol's here monthly and her presentations are always wonderful. And I'm just so glad so many people here to, take advantage and hear all this great information. So I know I have arthritis, which comes and goes. So I'm going to go home and look at this recording again. But I just want to say real quickly, so Carol will be back with us next Monday, which is September 30 already at 1 o'clock. So we're going to start off with a video that talks about osteoporosis. And then we're gonna have a follow-up Q&A where they also have some demonstrations of exercises, which are also key for osteoporosis as they are for osteoarthritis. So that's Monday at 1. So please join us for that. And then, like I say, an email will go out, an email blast. But we're also going to be having, focusing on cancer and talking about breast cancer and cancer in general during the month of October, and I believe in November, then we're gonna move on to another chronic disease, diabetes. We'll just one month by month. So thank you again, but please join us on Monday. We'll have the wonderful, fabulous Carol Penfield back with us next Monday to talk about osteoporosis, which I know will be another great event. So
At 1 o'clock.
wonderful. Thank you.